What sets us apart, I think, is really the people here. One of the things that I remember from interviewing here was that all of the residents, when we were doing our tours, knew everyone by name. They knew the nursing staff by name, the cafeteria staff by name, the environmental services staff by name, and everyone knew them too. And I really liked that sense of community.
When I came here, I just sort of fell in love with it because they had a lot of things that I was looking for. I wanted to do OB in my practice, I wanted to do something semi-rural, and I wanted something where I would be able to know everybody in the hospital, so the size of the hospital was really important to me.
So what sets our program here, Mayo Crosse, apart from other programs is we have the backing of Mayo Clinic, so we have a lot of support there, but we also have more of the community feeling of a community hospital where we have a lot of autonomy in what we do and a lot of responsibility with our patients. So I think it's good to have the educational support of Mayo Clinic with also having the ability to really get your hands dirty that a community program provides.
One of the things I really like about our program is that we are able to round on our own patients in the hospital when they get admitted, so you get a really close relationship with them. We also get a lot of not only faculty teaching, but also teaching from our upper level residents, and that helps us have a lot of autonomy both in the clinic and in the hospital.
The fact that we are able to really run the show with our patients and really, have a lot of autonomy in what we do. That gives us a really good experience. You're allowed to, make non-dangerous mistakes, but you're allowed to, try something and see if it works, and then develop your own style of practice from that, which is important for when you're done.
I think our program is unique in the size that it is, and that it is plugged into such a large hospital. We're small enough that we are an intimate group of people. There's only 18 of us. We are a fun-loving group of people who get along well.
As residents, we all get along with each other very well. I think that's a big draw for most people to this program. We do a lot of activities outside of the residency program. We do a really good job of, spending time with each other, and, when we get a few minutes, just kind of hanging out here and interacting with each other. It's a lot of fun. That's the best part about the program, definitely.
I really liked La Crosse, the size of La Crosse, but then I also really like how La Crosse is set up, and I thought that it was just a great place to live. We get both kind of the historic small downtown, and that's almost exclusively like mom and pop shops. There's very, very few chains downtown, and that's right next to the beautiful park and the river. And then just a short, like 5-10 minute drive away, we have Onalaska, which is about 16,000 people, and that's where you can get all of your big box stores. And it's really nice because that's not kind of impacting our nice little downtown, but we still have all of that within, a 10-minute drive. If you're looking to be that rural family physician, this place gives you all the tools that you need, where family medicine is very respected here. We are the only residents here, but then we also get one-on-one teaching from all of our specialists that are here as well, so you're not missing out on things that might not be at a smaller hospital or in a smaller town.
It's an incredible small big program because we have that big overarching program of being in the Mayo system, but we're a small community program within it, and I don't think you're going to find another program that has that really small family feel with such a large academic program behind it.
If you're someone who wants to have hands-on learning experience, wants to have, pleasant collegial interactions with other residents and faculty and other, specialists and consultants, I think this is the perfect program.